Namaste. Today I'll be talking about diabetic foot diseases. As all of you know, it is extremely common in diabetic population. Many of my patients complain of numbness, pins and needle sensation, sometimes loss of sensation. Sometimes they have to stay up the whole night because of burning feet, irritation. Sometimes they feel that they are not walking on the ground. They are like walking on a bed of cotton or so. At times extremely painful, cramps happening. So all these things are diabetic foot diseases because of diabetic neuropathy. So this is one part wherein the nerve supply to the feet are injured. This condition is called diabetic peripheral neuropathy. The reason for this neuropathy is glucose toxicity, as in the high levels of sugars which are circulating in your body. It reaches the nerves, damages the nerves and causes this neuropathy, leading to most of the symptoms. Now, there is another subset called diabetic ulcers, foot ulcers that you know of. They are also extremely common in diabetic patients. Coupled with reduced blood supply and nerve damage, these foot ulcers develop. The irony is that these diseases are totally preventable if the sugars are kept in normal range. The severity of diabetes or the high level of sugar levels in the blood, coupled with the duration or the number of years that you have been living with diabetes, that directly correspond to these diseases. To prevent it, daily self-examination of your feet is extremely essential, coupled with periodic checkup of your feet by your foot care specialist or your doctor. So there are two things that we check for when we check your feet. One is the blood supply and two is the sensation. Just by touching the feet, we know the blood circulation. Sometimes, if at all the blood circulation is impaired, feet are extremely cold to touch. Then the pulsation of the feet, we call it dorsalis pedis artery. Those pulsations are not felt if the blood circulation is impaired. And you will feel shiny feet or shiny shin in people who are chronic smokers, coupled with loss of hair because of, again, reduced blood circulation. So simply by observing the feet or touching the feet, we feel there are signs of reduced blood circulation. And along with that, there is one test called the Doppler test. So in Doppler test, we get to know the flow of blood as well as the pressure of the blood which is flowing. Thereby, it helps us assess if at all the blood circulation is impaired. Now talking about the sensation. As you know that it is the elevated sugar levels in the blood that causes these nerve issues. They literally act as toxins to the nerves. Very often, I see people walking away from their slippers. It would have slipped off and still they don't realize. And then they would be walking in the scorching sun without even feeling the heat because there is no sensation. And I have had patients who have come back to me with literally burns in the skin, and after that it getting infected, and in fact maggots also I have seen in such wounds. So it is important that these kind of slippers are not worn, barefoot walking is not done, and so on. So how do we diagnose it? Simple way is called a microfilament test or a vibration sensation test or biothesiometer. These are devices that we use to check the nerve supply or the nerve impairment of your feet. Now, certain tips to prevent these issues. Number one is keep your sugars in check. Number two is daily self-examination. So how do you do it? First thing is whenever you wash your feet, you have to wash with soapy water and dry them completely. When you are bathing, check the temperature of water with your elbow. See whether it is the right temperature. At times people want to do a pedicure and they have burnt their feet because they don't realize that the water is boiling hot. So before that, check the temperature of water. Prolonged soaking in water should be avoided because it can cause dryness. And after washing your feet with soap and water, make sure that you dry them thoroughly, and especially in between the toes you have to dry, because these are areas which are usually missed and their fungal infections or small cuts and things like that start happening. Then toenails, they really do need special care. So they have to be trimmed properly. If at all it is hard and thick nails occur, they can even press on the adjacent places and cause sores. Then these calluses and hard parts have to be prevented. They are because of friction. The footwear that you use has to be soft and comfortable for you. One size and one style doesn't fit all. Same way, if your feet are very sensitive, you may need specialized footwear for preventing the pressure sores and so on. Avoid using all these hydrogen peroxide, acids or corn removers and so on, because they can cause open sores and healing may be delayed. Avoid using knives, razors, blades and so on to cut your nails, or if there are any sores also, do not use that to clean it. Avoid walking bare feet. I still remember one of my patients, she had just walked in the garden. She came to me after 2 days with a big swollen leg, which was the swelling and cellulitis, which is like redness, increased temperature, severe pain, and it was extending till the thigh. That was because some kind of infection had gotten in from a small crack or fissure that was there in the heel. So in diabetics, you are very prone for that. So never ever walk bare feet. There are other causes of neuropathy, of course. One is vitamin B12 deficiency, alcoholic neuropathy, and thyroid diseases also cause some peripheral neuropathy. So coupled with all these factors, diabetic neuropathy is extremely common. To summarize, keep your sugars in control with diet, exercise and medications. Check your feet regularly for any discoloration, or if there are any corn or any callus or any fissure which has developed there. Check for dryness, pressure sores, uneven nails. Nails have to be cut properly. Check the temperature of water before taking bath, and after bathing, make sure that your feet are thoroughly dried, and get your feet examined for blood circulation as well as for the nerve supply by your doctor or your foot care specialist. So take care and bye.